And welcome back. This is the second in a series on fat-soluble vitamins. We started last time with vitamin E. We're going to finish up with vitamin E and then go to vitamin A. So, vitamin E has been employed in a variety of conditions in which antioxidant activity or lipid membrane repair is needed. Remember, it prevents oxidation of fatty acids, which form these lipid membranes in the cells. And you don't want those to oxidize because if they do, gaps form in the cell membranes which let foreign material into the cell. So vitamin E protects against this. It is a very, very strong antioxidant. Now, if you have an insufficiency of vitamin E, look, because it has an affinity for nerve cells, you can get a neuropathy. You can get multiple sclerosis, Parkinson's disease. You can suppress the immune system, mitochondrial disorders or energy disorders, epilepsy, diabetes, liver disease, and autoimmune disorders. Very important vitamin, ladies and gentlemen. You know, vitamin E's role as an antioxidant has actually raised speculation about whether a higher risk for age-related disorders might be considered a vitamin E deficiency disease. Think about that. Vitamin E is considered one of the safest vitamins. Now, some people who are hypertensive may experience increased blood pressure when taking vitamin E or increasing their vitamin E intake, so they have to watch it. And if you are a patient on anticoagulants, please use vitamin E with caution because vitamin E may increase your anticoagulant activity. So there's vitamin E, ladies and gentlemen. As you can see, let's start on vitamin A. It's a very misunderstood vitamin. Vitamin A is a fat-soluble nutrient, again, stored in fat, generally identified as all-trans-retinol. That's the chemical name for it, all-trans-retinol. The vitamin A family includes retinoic acid and the carotenoids. Less than 10% of the carotenoids have vitamin A activity, however. You know, we always think anything with carotene in it is great vitamin A, but really less than 10% of them have vitamin A activity. The beta, alpha, and gamma carotenes have the highest activity. So, what are the primary functions of A? Well, they're related to vision, immune function, again, it's a great antioxidant, bone development, cellular differentiation, and growth and reproduction. You need A, ladies and gentlemen. A is also required for detoxification of xenobiotics. That's a word that means foreign substances in the body, such as PCB and dioxin. So you need your A to act in detoxification, to act as an antioxidant in detoxification. The richest foods in vitamin A are liver, egg yolks, whole milk, butter, and fish liver. Now, carotenes, the ones that have vitamin A activity, are found in dark green leafy vegetables, yellow and orange vegetables such as squash, yams, sweet potatoes, and carrots. So eat those carrots, ladies and gentlemen. Vitamin A deficiency, let me make a note here. Back to, remember, cells, epithelial tissue, the lining of body cavities cannot be properly maintained without adequate vitamin A. So what happens? The cells that line the eyes get caught into this, and you have night blindness and poor dark adaptation. Cells that line the skin are affected, and so you get poor wound healing and dry eyes, and you become susceptible to infection. Vitamin A has been used successfully, for instance, in the treatment of infections such as measles in childhood. You know, diabetics have a decreased ability to change carotene into retinol, so low-grade deficiencies of vitamin A may develop in people that are or have diabetes. Other problems with vitamin A deficiency include weight loss, anorexia, decreased steroid synthesis, and remember, this can affect hormone production also. Also, poor tooth and bone function. Vitamin A may be useful in skin disorders such as acne and psoriasis. The carotenes have showed some promise in the prevention of both cancer and cardiovascular disease. Are you getting to the point where you see how important this vitamin is? Now, vitamin A is well known for its potential for toxicity, but you know, only 200 cases, or an estimated 200 cases, are reported worldwide each year. Symptoms of vitamin A toxicity would include weight and appetite loss, dry shedding skin, hair loss, fatigue, bone pain, headache, irritability, and joint pain. And most of these signs and symptoms subside once vitamin A is discontinued. Remember, ladies and gentlemen, it is a fat-soluble vitamin. Too much gets stored in the fat, and you can become toxic. So watch your intake of A. That concludes vitamin A. Next time we see each other, we'll talk about vitamin K and vitamin D. Okay, bye-bye.